I'm a registration officer under human medicine. I'm working for the Zambia Medicines Regulatory Authority as an assessor for human medicines. And quite interesting topic that you have presented on. And
thank you.
Well, okay. So my question, getting direct to the question, is with regards to nitrosamines, are we required to have the same control limits? Okay. Yes. So do we have to control the nitrosamines and have the same approach regardless of the duration of treatment? I understand. Does the model that we're using to calculate nitrosamines take into account the duration of treatment?
Yes. Yes, exactly.
The second question, so going forward, what approaches have you taken to improve on the formulation methods, or rather the formulations of the products, so that we mitigate the formation of nitrosamines? And for those formulations that we have,
I think,
are we required to request applicants to reformulate the products? Because I understand nitrosamine formation, the risk does not only come from the impurity or the excipients. There are some formulation approaches, for instance, for poorly soluble APIs. We understand they are quite notorious with regards to improving solubility. And one of the methods that has been adopted as a hot melt extrusion has been identified to be one of the causes of nitrosamine formations. So how, as the industry, do we aim at improving on manufacturing processes without really compromising on product quality as we tackle nitrosamines?
Yeah, so unfortunately didn't hear all portion of your questions, but the main thing is for standard nitrosamine there is a very defined acceptable intake limit which is going to be applied for all the medications, and that is for the standard small nitrosamine. They have the AI limit, whether it's in FDA, EMA guideline, etc. The compound specific AI limit that comes for the NDSRIs, which are, as the example I showed, and that's where you have to approach by the CPCA categorization, and that will give you a acceptable intake limit. So once you know that, then you can determine how to control that, by right analytical method, etc. So if you see that your limits are higher than the 10% of your target, it not necessarily it will immediately trigger a reformulation. So what you have to do is you may need some more, predictive stability calculation that can help in that case. You can put nitrite excipient scavenger. Those are also out there, for example, ascorbic acid and things like that. And that can help to actually reduce the amount of available nitrite to begin with. So that could be an easy fix for your formulation, for example. The other things is also when it's coming from manufacturing side, you have to have a better control on the utilities, on the water supply, for example, and other aspects like all the diagram. If you remember, I showed the sources of nitrosamine. Each will require a risk assessment done for those components, and that's how it needs to be done. It's a very comprehensive thing. A typical nitrosamine risk assessment could be anywhere from I have seen like anywhere from 80 pages more than 100 pages. So it's a very comprehensive thing that gets submitted at least on US FDA and EMA and other countries.